capital of non-communicable diseases. And this is revealed by a recent study from ICMR. So these non-communicable diseases include mainly diabetes, heart diseases, and obesity, along with hypertension. And now on the World Heart Day, so it is really important for each of us to be very well aware about the risk factors that are bound with the heart disease. So coronary artery disease is the most common heart disease that we see in India. And we Indians have a much higher risk of getting the coronary artery disease compared to the other part of the world. Now, thanks to the technological advances in life sciences, now genetic tests are possible to know one's risk on getting the coronary artery disease. And once these tests are called as polygenic risk score. This is not a diagnostic test. This is a screening test. So much in advance of the event, a coronary event, one can know about their genetic risk of getting the coronary artery disease in future. And what is the use? What is the application, or why we want to know this genetic risk? Knowing the genetic risk, one can modify the lifestyle based on the risk group you belong to. So the test that MedGenome offers, the polygenic risk score test called Kardiogen, puts the tested individual in either of the three buckets. So one is like the average risk. Average risk is nothing but the risk seen in the general population in India. Second is the moderate risk, which is a slightly elevated risk compared to the general population. And the third group is a high risk group. And the high risk group has about 2.5 times of getting genetic risk of getting coronary artery disease. So each lifestyle modification, the person who is in the average risk has to follow certain lifestyle changes, and moderate risk and high risk also. So the changes in the lifestyle factor, because what happens is like the coronary artery disease event is not solely based on, the majority of the disease cases that we see is not solely based on the genetic or lifestyle factors. In most cases, it is a combined effect. So one can one cannot reduce the genetic risk, but one can reduce the risk that is coming from the lifestyle factors. And there are a few lifestyle factors that we have, not given much importance, like stress at workplace, getting a proper sleep, etc. So, and the comorbidities such as diabetes or pre-diabetes or obesity, hypertension, etc. So, which are confounding factors for the coronary artery disease.